If you've ever sat at a restaurant with your hearing aids in, staring at your loved ones, and still felt like you were missing half the conversation, you're not alone. And if you're frustrated with struggling to hear in noisy places, I think Bob's story could help change things for you. I'm Dr. Shaina Stapleton, board-certified audiologist and founder of Better Hearing Rehabilitation Center in Durham. In the past 15 years, I've helped many patients like Bob who've come to me asking, why can't I hear in restaurants, even with my hearing aids in? Today I'll break down 4 surprising reasons that hearing in noise is still difficult even with your hearing aids in, and exactly what you can do to help change that. So let's go back to Bob. He came to me wearing top-of-the-line hearing aids that were programmed pretty well. But he said, I'm just not feeling like I'm hearing like I used to, especially in restaurants or when I'm out with my family and friends. So I pulled up Bob's audiogram, and this is what I showed him. Number 1, the normal range of hearing is between 0 and 20 decibels. So even people with normal hearing can struggle in noisy situations, but especially if they're at the lower end of the normal range. Bob's hearing was in the mild, sloping to severe range of hearing loss. We have to keep in mind that hearing aids don't restore normal hearing. They get you up to an area of correction between 20 and 40 dB. They don't make the auditory system perfect, just better. Even the best hearing aids provide correction, not perfection. This is one reason why Bob still felt like he was missing things, because in noisy environments, his brain still had to work really hard to fill in the gaps. Also, with his sloping type of hearing loss, he hears background noise, which primarily occurs in the low frequency range, really well, but was missing the details of speech, which in the English language are consonant sounds like S, F, and T that occur in the high frequency range. When you don't hear those sounds well, speech will sound muffled or mumbly even when it's clear. And in a noisy situation, the noise that you can hear really well can further mask the details of the speech that you don't hear well. I also explained to Bob what his inner hair cells that are damaged with his sensory neural hearing loss used to do. Cells in the inner ear don't just detect and amplify sound. They help filter out background noise, helping you to focus on what you want to hear and squelch out what you do not want to hear. And once those cells are damaged, they don't regenerate. That means that even with hearing aids, your brain doesn't get the same clean signal that it used to. Imagine trying to read a blurry sign through a magnifying glass. It's bigger, but it's still blurry. That's what your ears are doing in noise. But this is what surprised Bob the most. He'd gone years without hearing aids before he finally decided to get them. And during that time, his auditory pathways had weakened. That's right. Your brain stops processing speech clearly when it doesn't get the stimulation it needs. This shows up in word recognition testing during an audiometric exam. If we see poor scores, it often means damage to the pathway, not just to your ear. Think of your auditory system like a muscle. If you stop using it. This is why wearing your hearing aids consistently is critical, even in quiet environments. Your brain is constantly adapting, and the more practice it gets, the better it performs in noisy environments. Unfortunately, Bob had really poor word recognition scores, which meant sound was becoming distorted along his damaged auditory pathways before it reached his brain. Hearing aids cannot get around damaged auditory pathways, so it's very important to keep them healthy and stimulated. The 4th reason Bob was having so much difficulty in noise is that he had good top-of-the-line hearing aids, but they were a 5-year-old model. And while they helped in quiet settings, restaurants were still a nightmare. Why? Hearing aids are built to last 3 to 5 years. Once they get near the end of their shelf life, they'll likely still be working, but they just won't be as effective due to degradation of the internal chip. Also, lower-level hearing aids have a harder time focusing in on speech when there's noise around. Newer and higher-tech hearing aids can do a better job of using AI and directional microphones to prioritize speech and suppress background noise. Big difference. Plus, the poor sound quality from lower-level hearing aids makes people more likely to have to take them out, which just starts that use it or lose it cycle all over again. So, we upgraded Bob to premium-level devices with better noise reduction features and gave him a remote mic accessory. A week later, he came back smiling. He said, I finally kept up with the dinner conversation. But let me leave you with some practical science-backed tips that you can use right now. Number 1, face the person who's speaking. Up to 40% of conversation comes from visual cues. Also, in restaurants, sit with your back to a wall or sit in a booth if you can. This minimizes noise that's coming from behind. Use your hearing aid app. Adjust the settings for noisy environments. Most people never touch these, but it can be really helpful. While in background noise, change the directionality to focus front if possible in your app. If necessary, ask your audiologist about hearing aid accessories, such as remote mics. If your current hearing aids sound muffled or distorted, consider upgrading your current technology, especially if they're lower level technology or over the age of 4 years old. Wear your hearing aids every day, all day, during waking hours. It's like going to the gym for your brain. And above all, stay engaged. Social isolation from untreated hearing loss is one reason we see a very high correlation between untreated hearing loss and dementia. Staying connected protects your cognitive health. If Bob's story resonates with you, don't give up. There are solutions. Sometimes it's just about understanding the why behind the struggle and making the right adjustments. I'm Dr. Shaina Stapleton. Thank you for being here. And if this has helped you, please let me know in the comments and share this with someone who might need to hear it. And I'll see you in the next one.